All right, I'd like to continue with kind of this discussion of legal issues related to human genetics type studies. And again, this is a bit of a broad overview. We're kind of looking at a number of different things in this, and we'll break them into a series of lectures. We've already talked about the Davis discussion. And I have a few more topics that we want to discover. So let's take a little bit of look here at what we've got else. All right, so I want to look at incidental results, which we're going to talk about in this lecture. We'll talk a little bit about sex testing and some of the outcomes that I've seen from that. And then we're going to talk about some more general things, such as what does it take to be an expert witness? What do you need if individuals go into court to report? What do they need to be an expert witness? Okay, but for this one, we're going to talk about incidental results. So let me set this up. Here's a situation that's a bit long, but to talk about it. So we have this woman, Connie. She's 41 years old. She has an unexpected pregnancy, she and her husband. And she says, well, I'm 41. Maybe I should find out a little bit more about this. So she Googles and she finds out that in her age puts her at a higher risk of having a chromosome anomaly, right? We know about the maternal age effect, and especially Down syndrome. Now, she's had 2 children before. Her children had normal pregnancies. They're now 13 and 17, so they're quite a bit older. She consults a genetic counselor who suggests she go ahead and have amniocentesis. As she is 16 weeks pregnant, they want to move forward to see with the results. And so she agrees to have the procedure. Well, the test results show that she does not have trisomy 21, okay, nor any other autosomal problem. But the results do show to the counselor that she has an extra Y chromosome, that she's going to have a son, and it's going to be an XYY individual. This is known as Jacob's syndrome, or XYY. Okay. This is a very common condition. Number of children are born every year, males are born every year in the US with this condition. It's a fairly benign outcome because Y chromosomes are really not that major, right? But it leads to a question. They're now faced with some questions, right? What should she do, right? You have to keep in mind that she went to this counseling, went through the procedure because she was interested in things like Down syndrome and more serious problems. And the question is really, should the individual that was involved, the genetic counselor, tell her about this abnormal genotype and neurokaryotype? If so, why? If so, why not? Okay, this might be a question that you see on a test. So basically what we have is we've got what's known as an incidental finding, an IF. And so should the counselor inform Connie of these results is the basic question. Okay, so these are known as either incidental findings, IFs, or secondary findings. And these have become very important because they've been a long-standing issue in pathology. You know, you go in, you take a biopsy or something, and no, we didn't find that, but we found something else. And certainly with the advent of things like full genome sequencing, quick ways of finding genotypes and things, it's becoming a bigger and bigger question that we have. Now, the general answer, overall kind of general answer, if the condition that you find, this is coming from long-standing practice, clinical practice, is that if it's harmful and you can be treated, then you generally report it. Okay, that's the basic outcome. So in general, if it's harmful and the treatment is available, then you report it. Now, there are lots of disagreements about how this is. Certainly for prenatal, which is the case of the prenatal conditions. What about juveniles, children? Do you report in children or not? Is this going to stress the parents? What do you do? And then of course with adults. So the very levels of where this occur end up having, different outcomes that can matter. So but the genome sequencing, at least, now again, we're talking about a case here where we've got XYY, we've got chromosome, but it applies more generally to genome sequencing. there has been quite a bit of work done outlining this, following this general rule that if it's known to be harmful and treatment available. The American College of Medical Genetics, in about 2013, came out with a big panel that worked for about a year and a half, and the report came out in 2013. And they said there are a number of gene variant combinations that we do recommend, things that result in things like Malfman syndrome, these other series, that we do have a strong recommendation that if it's known in an adult, that you report it. And that's different, slightly different than in children, but in adults you would report it. Okay. Subsequently, there have been a number of extra thoughts about this. It still carries this recommendation, but I put a paper on Canvas for you called Incidental Finding paper. It's a long title, but it has a full discussion of all these issues. It goes back to the 2013 paper, talks about the variants and things that have happened since then, and looks into a good broad discussion of it. So I recommend that if you're interested in this, that you find it. The basic idea is that you do report it. Okay. Now the second part of this is, all right, what about her husband? Okay. Should you tell him about the amniocentesis results? Because she's married, okay, and it's a joint decision. And let's say that Connie decided to terminate the pregnancy. Maybe it was a Down's child, okay, instead of this FXYY, or maybe either way, she decided that she's older, she doesn't want to risk it, so she decides to have it. So if she chose to terminate the pregnancy, should the husband be consulted or consent to it? And the answers are pretty plain. In Planned Parenthood v. Therefore in 1976, a Supreme Court ruled that there's no demand for spousal consent is required for an abortion. So if you wanted to have an abortion, this also says basically you don't have to tell the husband about these amniocentesis results. And it's the same basic thing. It's following under this rule. And then there was another revision of this, Planned Parenthood versus Casey in 1992 is one of the precedent cases that's still there. And the Supreme Court again reaffirmed Roe v. Wade. Now remember, Roe v. Wade is based on this concept in the Constitution about privacy, the right to privacy. Okay, it's not really directly, while it deals with abortion and things, it's about privacy. That's why it's important here. That's why they're saying that a woman has the right to privacy regarding things like abortion. So not only does you not have to have spousal consent, you don't even have to have spousal notification, okay, of it. So this was the case in 1992, and that's the prevailing model that exists at this time. Okay. All right. So the answer to those questions are, would you have to tell the spouse no? Would the counselor, if Connie decided to have and go through with a termination, would you have to tell the spouse? And the answer is no. Again, okay, there's no consent required and no notification even required. And therefore, none of these, the answer to both of these is that no. Now, that doesn't mean that Connie wouldn't do it, okay, that it couldn't be done, but it was not in the requirement nor a proper legal for the counselor to inform the spouse. Now, here's another issue, and this relates to Roe v. Wade again. Okay, that's why it's a little different, but there are these ideas that you can sue. People like to sue. We're in a society, and there's what's known as wrongful birth and wrongful life concepts. Okay, a wrongful birth is where parents sue a physician, or counselor, or someone else if there's been a problem. So a birth that was either unexpectedly had problems, or so you might have a child that's born with Edwards syndrome or Patau's or something, huge medical costs, huge things, and the parents were not informed that there was going to be a problem. So the parents argue that the doctor's inaction prevented a prenatal test or the results to be properly brought forward. Therefore, they could not make an informed decision. Now, this is important because it again relies on Roe v. Wade. Okay, because as long as Roe v. Wade is in place, mother has a choice. Okay, if they could make an informed choice. A positive verdict usually requires that the mother can say that she would have terminated the pregnancy. And the reasons for this lawsuits include things like doctor fails to tell the patients of available tests. Okay, so a 41-year-old woman, Connie, goes in, doesn't bother to tell Connie that you could be tested by amniocentesis or by other methods. And we, of course, have more less invasive methods now, but there's a mix-up in the lab results. Comes back and says, no, there's no problem, but there was. Wrong tests are incorrectly done, so the lab wasn't certified for the test, or they simply did it incorrectly. Or some cases, the doctors deliberately choose not to tell the parents. Okay, doctors make ethical decisions sometimes based on their feelings about things, and even though they shouldn't, they did. So if this all comes about, then you can go to court and sue for wrongful birth, basically trying to. Usually these cases are trying to get resources to help pay for the child, the care, or to cover medical costs that occur. And so the outcomes are based on two basic questions. Could a diagnosis of the condition have been made in time to allow a termination? That's under Roe v. Wade. And was the condition serious enough that a reasonable person would have terminated? And would a person have made that decision? Those are the two things that are there. Okay. Now, wrongful life is you go ahead and have the birth, right? And in this case, instead of the parent suing, the child sues. Well, on behalf of the child is sues. And what the child will argue is that because of inadequate by the doctor, they were born into a life of pain and suffering. Again, it relies on Roe v. Wade because a decision could have been made for this. And the basic reasons are the same thing as for wrongful birth. Now, this is a much more difficult one to argue for. There's only a few places that recognize wrongful life. There's a number of states that recognize normal wrongful birth rulings. California, New Jersey, Washington are the only ones I know of right at the moment where it's been successfully litigated, on behalf of the child. Places interesting. I wrote down Germany. No, and not because there was a feeling that it wasn't proper to do it, because they believe in dignity of life. In other words, there are laws in Germany about resulting from past things about the dignity of life. Once individuals are born, no matter what condition they're in, who they are, their life has dignity. So you can't say that you can't go in and sue and say I have a wrongful life, because there are these rules that say no, life has dignity in it to itself. Anyway, again, if you go through this process in these states and the child goes through a process, you still have to say the same thing. Could a diagnosis have been made? Would a reasonable person have terminated? All right. Well, that's really the first part of this. I wanted to introduce this idea that you have incidental findings, and that there are outcomes and procedures in place to look at those incidental outcomes. And there's incidental findings, right? Or secondary findings. And these are really, again, really starting to see these become important when we do these big genomic studies. And places have gotten, some of these things have gotten into a bit of trouble. Ancestry.com, some others similar to those, because they do look for lots of different markers. And at one time, some of those things were saying, okay, I can give you a genetic health report. I can tell you about these things. Well, did you agree to have that report or not? You still extract those data now if you want yourself, but they don't automatically provide those sorts of things. And a lot of it had to do with incidental findings or secondary findings that came along.